You know. We are live. Hello, everybody. This is Del K. Brereton, and this is The Real Spiel. And today I have a special guest here who I think is going to enlighten and educate us in areas that many of us suspected, but we didn't have a professional on the spiel to really break it down. I think this video is going to be seen around the world and used as a reference source to things that people have been worried about, suspected for a very long time. This is Melissa Sadore. Hello, Melissa.
Hi, thank you so much for having me here.
My pleasure. And Melissa is a nurse practitioner, and for many of us who don't know what a nurse practitioner is, I'm going to allow her to explain it. But it's basically as close as a doctor you can get without being a doctor. But Melissa, please let us know. You are in Canada. You're a nurse practitioner in Canada. We know that doesn't mean anything. You can do that probably in a lot of places. But tell us what a nurse practitioner is and explain it to us before we go any further.
Yes, absolutely. So, excuse me, nurse practitioners are registered nurses first and foremost. So we have to have been a registered nurse for at least 5 years. And then after that, we can apply to go to school to be educated to become a registered nurse in the extended class. What the extended class allows, sorry. Can I keep going? Yeah, so what the extended class allows us to do is that a nurse practitioner can independently assess a patient, order all the diagnostics that need to be ordered to find out what's going on with this patient. We can independently diagnose this patient. We can independently prescribe a treatment plan for this patient. And we can independently follow up with this patient. So we essentially are independent practitioners who can assess and prescribe for patients.
That's right. So, I mean, and just so for us to know, as far as a general practitioner goes, is there anything that a general practitioner do? Can a general practitioner do anything that you cannot do?
So, yes. Nurse practitioners, so what general practitioners, your GP can perform a surgical procedure as an assist with a surgeon. Nurse practitioners cannot do that. However, we are allowed to perform any procedure that we have the education or expertise to perform. So our legislation, our guidelines, our standards allow for us and allow for that flexibility. So if I'm thoroughly educated in whatever field, I can perform procedures in that field up to a surgical procedure, right?
Right. And nobody's letting a general practitioner do any surgery on them anyway. They're going to a specialist. So effectively, whatever he can do, you can do, or she can do, you can do. Whatever a GP doctor can do, you can also do.
Essentially. Right. But I want to differentiate in the role, though, because all throughout my career, I've had so many patients say to me, so why don't you just go all the way and be a doctor? And that's not something I'm interested in, because what I value about being a nurse is that we are educated in caring, right? It's the art of caring. And our education allows for that. And that's why I went into the field. I actually care. And so the medical education doesn't put as much of a focus on that. And so that's why I would never want to be a physician. I'm so happy in being a nurse because I value being able to express the caring aspect of medicine, right?
Right. And can you explain, when you talk about, and Yvonne is just saying congratulations and welcome, nurse practitioner.
Thank you.
Tell us where you were educated.
Right. So I did my undergraduate degree at the University of Windsor. I did my degree in 4 years. I felt called to be a nurse pretty in my teens, and was really driven to complete it, and and worked really hard to complete it in 4 years, which was something that I don't think very many melanated people did in our program. I think I was one of the very few. It's not an official statistic, of course, but I know that all of the ones that I started with, I didn't graduate with. So
right. So it's demonstrating that you have a level of proficiency that even outperforms many of your peers, both ethnically and otherwise. And so I said all that to say this young lady is going to be giving us some insight into the COVID-19 vaccines. And she's had some really extreme personal experiences where she has been compromised, she has been blackballed, she has been lied on, she has been conspired against, because her entire intention was to give people real information. Take us down the pathway, start us in the hospitals or where the clinics or wherever you were, and tell us what you saw when it came to COVID-19 from people from companies like Moderna and Pfizer. Tell us what you saw that caused you to be extremely conscientious about dispensing the vaccine as a nurse.
Okay, so let me be clear on how I got involved in this whole COVID-19 fiasco in the first place. So in September of 2021, I had a patient of mine. It was a former patient of mine. I was a nurse practitioner within a family health team. That family health team folded in May of 2021. So I was no longer with the family health team, but this patient I had kept in contact with. And they reached out to me, and they were sharing that their employer was implementing the COVID-19 vaccine mandates, right? And due to their health concerns, which I was privy to, they have several allergies and other health concerns, they were really reluctant to take this COVID-19 vaccine. So they did have a primary physician, a primary doctor that they went to and asked, and shared their concerns with their doctor, and asked them for an exemption to the vaccine to provide to their employers so that they can keep their job and not take the vaccine. So this physician that knows this patient's medical history looked at this patient and said to him, "You are part of the problem," and told him he's not giving him an exemption and to leave. So essentially, this physician was implying that this patient's hesitance about his health was prolonging the pandemic, right? So when this patient shared this with me, I said, no, let me see if I can help you, okay? I said, let me see if there's a way to help. I'm a nurse practitioner. I know that they're authorizing nurse practitioners to give medical exemptions to COVID-19 vaccines. Let me see if I can help, right? So I did a search online. Sorry, I have to.
Did you say they were not, or they were authorizing when you finished drinking?
Nurse practitioners were authorized to. So
as a nurse practitioner, if you saw fit to give someone a medical exemption by law and by, I guess, the College of Nurses, and all your governing bodies, you are perfectly within your rights to be able to do that.
Absolutely. So nurse practitioners and physicians were both authorized to issue medical exemptions to COVID-19 vaccines. And I was a nurse practitioner. So I had the credentials. So I said, let me see if there's a way to help this individual.
You are a nurse practitioner. You still.
I am a nurse practitioner.
Yeah, okay.
I still am. I can still represent myself as one, yes.
Right.
And so I went online and I did a search to see, okay, what's the criteria by which we can authorize these, this and that and the other. And I found something called Directive 6. Directive 6 is a directive that was put out by Dr. Kieran Moore, the Chief Medical Officer of Health. And it was a document intended to guide those that employed healthcare professionals. So essentially it was sent out to like the human resources department of hospitals and the ambulances and midwives. So it was a directive to guide those employers, those that employ healthcare providers. It was a directive to guide them in implementing COVID-19 vaccine mandates. Okay. So this directive, it's hard to find now. The ministry has taken it away from their websites only because it's been retracted. Okay. But this directive, I have copies, but this directive does give, it encourages employers to offer their employees these three options, okay? Option one was to have their employees provide proof of full vaccination to COVID-19 vaccines, okay? Which at the time was for 2 doses, right? Option two was to provide a medical exemption to these vaccines, okay? Now, to qualify for a medical exemption, according to the Ministry of Health, one had to have had 1 dose of the COVID-19 vaccine and had a reaction, okay? And then that didn't automatically qualify them for an exemption. You had to be assessed by a specialist to see if you could still get the other dose.
Let's pause really quickly
Certainly.
on that sentence. First of all, I want everybody to start sharing this right now, because this is what she's about to get into right now. Please start sharing this. Like, share, and subscribe. This is The Real Spiel with nurse practitioner Melissa Sadore. She's about to tell you that in order to be exempt from taking a vaccine, you have to take the vaccine and then have a negative medical circumstance take place in your body in order for you to be exempt from a vaccine that you just already took, but you should not have taken. Continue. I just want to be clear as people start sharing this and telling the story.
And I have the documents. I have the documents, right? And I'm not
making Directive 6. This is Directive 6.
Oh, Directive 6, right?
Right.
And so that's how you would qualify for a medical exemption. So needless to say, there was no medical exemption. Sorry, so the other qualification is if you had a history of myocarditis and you were between the ages of 12 and 17. So if you were 18 and older and had myocarditis before the vaccine, you still had to take it. Wow. According to this directive. So it was an allergy to any of the components of the vaccine was another way you could not have a dose. So if you had a documented allergy to any of the components of the vaccine, which who knows that they're allergic to what's in the product, right? It's very hard to qualify for that. So the only qualifications for exemption were a documented allergy to a component of the vaccine. The other was if you had a history of myocarditis, if you were between ages 12 and 17. If you were 18, you still had to have the vaccine, even if you had myocarditis, even though it was known that it was a side
if you had a myocarditis, explain to us what it is, please.
Myocarditis. So myocarditis is, it's the inflammation of the heart muscle, okay? We've heard a lot about it recently.
Sorry, just because on my side, you went out. Tell us again, just define it for us again, what myocarditis is.
Myocarditis is inflammation of the heart muscle, okay? The heart muscle, like that muscle we need to contract, right? Those fibers. It's inflammation of that.
So if you have the inflammation of the heart,
yes,
as a child, going into your adolescence and all the way to 17, and then now you're 18.
Yeah.
Now you've turned 18.
Yeah.
You still would have been told you must take the vaccine.
According to Directive 6, yes.
According to Directive 6, thank you.
Yes. And so those were the only qualifications: a documented allergy to a component of the vaccine and a documented history of myocarditis. If you're between the ages of 12 and 17, and 12 because that was the age that we were starting to vaccinate, right? So. Now I do have to give the Ministry of Health credit.
Okay. And so
Yeah, let me finish this thought because it's important. I do want to give
Are we doing that? Okay, go ahead.
So this directive was authored in August of 2021. In January of 2022, they did include anybody with a history of myocarditis now could be exempt. They did update the directive.
They amended that.
Yes.
Was that still Directive 6 or was that called something else?
It was oh sorry, this wasn't Directive 6. This was the Bible that we were supposed to follow to qualify for medical exemptions. So both information was in both the directive and in the Bible. We didn't talk about this.
What's the actual name of the document? What's the actual name of the Bible?
You know what? Let me find it for you. Sorry, I don't have it right.
No, I don't want to stop your story. We can come up with it later. But so you had a volume that basically was all of the tenets of what you should and should, the shoulds and should nots. Yes. And essentially it was the sacred document of
that we all had to follow. Which his opening statement said, this document is only intended to be advice, and it's not supposed to superimpose or replace medical or legal advice. That's the first sentence of the document. Wow. And then it gives you all the guidelines by which they say that I violated. But we haven't gotten there yet.
So the document was a guideline that you as a practitioner don't necessarily have to follow because your medical advice supersedes this particular guideline. Go ahead.
That's what the document says. That's how it reads, first sentence.
Okay. And so where we're getting to, everybody, is that they have attacked her for essentially doing her job. And there's two sides to every story. We all know that. But when you listen to the rest of the story, you're going to understand a lot more. So please continue. I don't want to interrupt you. I know you have a patient to see in a half an hour, so I want to make sure you get your time.
So Directive 6, that's where we left off, right?
Mm-hmm.
So option 1 again was to show proof of full vaccination. Option 2 was to show proof of a medical exemption, which you couldn't qualify for. It was very hard to qualify for. Mm-hmm. Option 3, though, right, was to show proof of attending an education session that outlined 5 different things about the vaccine. It was basically the safety associated with the vaccine, the development of the vaccine, the side effects, the benefits. It was 5 different parameters that the ministry outlined in that document, right? And once somebody had showed proof of attending this session, they could decline the vaccine, right? So those were options. Yes.
So this is so basically they're saying you can get an exemption if you have obtained as much information as they would allow you to have.
They had a criteria by which they wanted you to learn a criteria of information. And then once you learn that, then you can decline. Now,
and what's that called?
Sorry?
What's that called?
It's called informed consent.
Informed consent. That's the word we need to hear. Okay,
now, I will say, we already have something in place for this. Now we all know that there's ministry mandated vaccines for children to have in order to attend school, right? But I've been a primary healthcare nurse practitioner for many, many years, and I've had patients who choose not to vaccinate their children. So if I do have a parent that chooses not to vaccinate, my requirement is to send them to this education session that teaches them medical information from a professional about these vaccines in order to make sure that the patient is informed, right? Once this parent hears the information from a medical professional, then if they still don't want their child to be vaccinated, they are allowed to decline and be exempt so the children can still attend school. So there's a thing already out there about this. So I found Directive 6. So that just showed, okay, wonderful. I'm going to put on an education session, right? And so what I did was I developed a Zoom session. I put it on for anybody who was interested. I made it really scholarly, okay? I just did my master's. I finished my master's in 2019, so it was pretty fresh in my mind on how to cite things and whatnot. Because I knew that they would probably be asking me about what I was doing. So I went into this making sure that I was dotting my I's and crossing all of my T's, right? Because I had that sense. So
So let me just clarify.
mm-hmm,
The informed consent guidelines
mm-hmm.
of the ministry, you said, I will turn that into a course of some kind and
Yeah.
utilize the guidelines of the informed consent as a professional medical person and essentially give these people that informed consent information in respect to COVID-19. Okay, go ahead.
Right. Yeah. So and more importantly, because I knew that they were going to be looking at what I did with a fine-tooth comb, I said, you know what? I want to make sure that I'm presenting information to the public that's very reputable, that's most up to date, and that they can't argue with. And so I didn't want them to accuse me of misinformation or anything silly. So I said, you know what? I could get the best information to present to the public from the actual developers of these vaccines. So I used the Pfizer and I used the Moderna product monographs. So for those of you that may not know what a product monograph is, a product monograph is if you open a box of Tylenol, inside that paper that's folded up really small with all the little writing, that's essentially a product monograph. It's something very important for any clinician that prescribes, right? So that's what we are taught to refer to because that has the most up-to-date information, right? They did the studies before they released the product, and so they have the most up-to-date information. So I said, listen, I'm just going to use the best information, so I only use information from Pfizer and Moderna's product monographs to present to the public, okay? That's what I did. That's what I did.
Yep, okay. So you took the information from the manufacturer and said, I'm going to tell you what the manufacturer says is in the vaccine. Yeah. How else would you know?
Exactly.
That's the only way you really can know. And that's the best source to know. That's
what I thought, right? And so what I think is also important to know is that at the bedside, so when nurses and doctors and clinicians were administering the COVID-19 vaccines, when they were getting them out of the boxes, that product monograph was still in those boxes. But it's important to note when you open them up, they read intentionally left blank. So at the bedside, nurses and doctors were not able to read that monograph. I had to go online to find the monographs, but they were there. They were there clear as day. I accessed them in September of 2021. It's cited on my slides. I can't remember the date, but it's there. But yeah, I accessed the monographs then, and I used the information from the monographs to present to the public.
Okay. Yeah. And then what happened?
Yeah. So once people came to the classes, I put the classes on for free, right? I just wanted the information out there. Like this wasn't a money-making venture for me. It was time-consuming, but I really felt that it was important that people were able to exercise their right to decline this product, right? Because as a practitioner, I'm just thinking, like from everything we've been taught, this product was just developed, right? And so if it was just developed, there's no long-term safety data.
The fastest vaccination in the history of vaccines. Nothing has been faster.
That worried me. It bothered me.
Nothing has been faster. Go ahead.
It bothered me. So I felt for people. I was fortunate in that the employment that I had at the time did not require me to be vaccinated. They respected my choice to decline, but I tested, and that was fine. But I do have to say the employment that I did have, because I was teaching this course on my own time, they fired me. I was the medical director of a men's sexual health clinic. And they fired me because on my very own time, I was doing this course. They found it at odds with their policy that everybody should be vaccinated if they can be, right? And they didn't want to be associated with me that was doing what I was doing. So yeah, I was let go from that job in December of 2021. As a
And you know
result
what?
of
If
me
it would
teaching,
have ended there,
yeah.
as a result of you teaching what the ministry guidelines were in respect to informed consent, that company decided to let you go. But it didn't just end there, did it?
No, unfortunately. So it's quite clear that the College of Nurses was well aware that that I had no employment, right? Because as nurses, we're required to update the registry with our employment. And so once I was let go from this company, I immediately updated the college website. And so they were aware that I had no employment.
Mm-hmm.
In February of sorry, let me go back. In November of 2021, so I started these Zoom classes. They were free. Anybody could come. I sent the link out. I said, share with your friends. Anybody could come. It is important to say I did charge for after if they received the information and they wanted the letter to say that to prove that they came to the course and that they didn't want the vaccine. And I gave them that letter. I charged for $100. But I
Now hold
also
on.
said at every class.
Now, if I came to you and I need a
Mhm.
work letter,
Yes.
right? Because I need a work letter to, oh wow, we zoned out for a minute. Currently, do you charge for that letter?
Everybody charges for that letter. Absolutely. Absolutely. But I wasn't only just
Okay.
giving a letter.
Workman's
I actually,
compensation.
oh yeah, we get paid for paperwork as nurse practitioners and
Yes.
physicians. Absolutely. Right. And so
So
but the
you
point
weren't
is
doing anything outside of the context of how you normally charge for what you do for a living. This was not something that was a one-off. This is not a preacher charging money for prayers. You know, this is not
no,
this is not you on the corner of the street charging money for prognoses. This is you working
no.
within your practice. This is you
Yeah.
still functioning as a nurse practitioner. This is you providing a medical service. This is you providing documentation and authentication that individuals actually took this with a certificate, and now you are charging for that note. And it's for the note you were charging. Were you charging for the course
Well,
and the note?
Well, so that's what I was lumping it in. If you wanted just the information, fine, have it for free. But I did have to compensate for my time somehow, and I said I'm only going to compensate for the note. If you need the note, I'm going to charge $100. Every class, though, it's important to mention. I said, listen, don't be financial limitation be a reason you don't reach out to me, right? And in fact,
Mhm.
I issued the letter before getting paid. I don't even know if people paid me. some people, and I know I
Right.
probably should have put it out there because it wasn't about money. I just had to compensate for my efforts and my time in some manner, and so I just arbitrarily
And
assigned $100.
you weren't currently employed. This is you beginning your own practice now,
I
right?
stumbled into this. Yes, I stumbled
Exactly.
into
Because
this
before you
practice.
were an employee, but
Mhm.
now losing that position, you start to now function. You put your sign on the wall, which I think a lot of people should do, and who have
Mhm.
professional designations. And you said, as a Black melanated person who's conscientious about your community, you're going to start your own practice. You're going to set fees for the services that you render, and you're going to continue within the context of your training,
Yeah.
qualifications, experience, and facilitate a service to the public, which you will charge for.
Yes.
I don't see a problem yet. To
Thank
me,
you.
I don't hear any malfeasance taking place yet. But continue, because clearly
The other
that
thing,
wasn't what folks thought was appropriate.
the other thing that it's important to add is that I didn't charge for children. So like if people wanted the letter for their children, anybody under the age of 12, I did not charge because I thought it was ridiculous. So it really wasn't a money making ordeal. It was just to actually a sign of value. Like it was my time. I had to compensate for my time. So in me doing this, in November of 2021, I started to get emails from the college saying, hey, they're investigating my practice. I'm like, okay, cool. Investigate away, because I had everything ready for them, right? Because essentially what I'm doing is something that I'm trained. This is what we're supposed to do. Part of I spend the majority of my practice educating, because that's the type of practitioner I am. I want to make sure you know what you're taking. I want to make sure that you know all the different options so that you can make the informed choice. Because at the end of the day, it doesn't matter what I think you should be doing. You decide for yourself what you do with your body and what medications to take and not to take, what treatments to take and not to take. It's up to you, right? And I firmly believe in that. And I actually thought that that was the foundation of my profession, but I'm looking around and I'm really questioning that, and it makes me sad.
Yeah. Now let's get to the part of where you now start getting, the Ministry of Health comes for you. They start putting sanctions on you. Let's tell us how we get there. How does that start happening to you?
So again, I'm sorry I got a little bit sidetracked, but yeah, in November they started investigating.
We need all the background. Yeah. So go ahead.
In November they started investigating, and in February, without any warning, they didn't ask me to stop teaching the classes. Once they investigated, I said, okay, I was giving them what they asked for, but I kept teaching the class. And at the time, I was covered. I had we were required to have malpractice or professional insurance. So, of course, I had insurance I've been paying into since I've been an independent practitioner.
How much?
It's $10 million in coverage.
$10 million. $10 million.
Right.
Okay. And that $10 million is supposed to cover you when they come for you. Okay.
Absolutely.
Did it cover you?
Well, when I went to apply to use this, they told me I wasn't covered because I'm trying to defend myself because of COVID.
Wow. So COVID is an exception to your $10 million liability as a practitioner. They're going to say, we'll cover you from all liability unless you mess with that COVID. Once you start talking about COVID, all your insurance goes out the window. Hey.
That's what happened. Well, no lawyer, right? February 7th, 2022, the College of Nurses restricted my license to practice nursing without any warning. They didn't ask me to stop teaching the course while they investigate. They just went to right straight to restricting my license to practice. This is all public information. You guys can Google it on CNO Find a Nurse, right? And put my name in Melissa Sadore, and it's all there. I'm not allowed to practice independently I can't practice without supervision. As a nurse, I can't represent myself without supervision, right? So I require another member of the College of Nurses of Ontario to supervise my practice, among other restrictions.
For how long?
Well, so this has been since indefinitely until there's a resolution, until my hearing, right? And then after my hearing, then I'll get my penalty or my consequence, right? So this is so again, this is not the only restriction. I can't practice independently. I need somebody to supervise me at all times. I cannot teach COVID-19 vaccine education. I cannot issue exemptions to COVID-19 vaccinations. So those are all of the restrictions. They're all there.
Say those again. Say those last three again.
Yeah, I cannot issue COVID-19 vaccines. I cannot issue COVID-19 vaccine education. I cannot issue COVID-19 vaccine education. I cannot practice independently. I require a supervisor to represent myself as a nurse. And then, of course, I need to tell anybody that I applied to a job of all of the charges against me, right?
Now, can you tell us of some of the other charges? I know we can look it up online, but
So there's 3 charges. The first charge is that I issued up to 393 medical exemptions. They said. They're characterizing them as medical exemptions, although the documents clearly state informed consent. They don't say medical on them. Mm-hmm. I did issue a few medical exemptions, 9 to be exact. Mm-hmm. And they say medical
exemption.
exemptions. So the distinction is clear. But despite that, the website says that I issued up to 393 medical exemptions to patients without properly assessing them. I didn't give a medical exemption. With the medical exemptions I did issue, I did assessments, and they have the assessments. They have my clinical notes. They have all of the evidence, but they're saying that I did not provide assessments for people that I taught an education course to, when that's not required, right? The exemptions were not based on their medical history. It was based on the fact that I taught them information, and then after learning this information, they didn't want to. So that was the actual exemption, and that's what they say. But despite what the evidence demonstrates, this is what they've written publicly about me, and it's been there since February of 2022, right? And so they knew I was unemployed at the time. Having all of these restrictions, you can imagine what employer, like the first thing that employers list on the requirements is to be in good standing with the College of Nurses, right? And so I'm not. So it's been tough. It's been tough.
So currently now, you function with supervision. Do you have somebody that supervises your practice, allowing you to work? Okay, so you do have that level of coverage.
I have the restrictions satisfied, so I am practicing. But I just really wonder what having that written publicly has an effect, because most people check their practitioners out, or maybe not most, but a lot of people do, right? And this is what's publicly written about me, and it doesn't accurately reflect what I did, right? So it's tough. It's been tough.
So therefore, they're not only charging you, but they're slandering you, and they're affecting your employment. They cause you to be researchable. They're making you nuclear in your own industry, and they're making it so that anybody that hires you, anybody that comes near you, will say, "Oh, she's a potential problem for us," right? But what they've done, though, effectively, is they've driven you to independence.
Yeah.
And what I'd like to say to members of our community, and even others that have gone through this incredible tug and pull about COVID-19 and the vaccines, you have right here a living, walking practitioner who did not bow, who did not allow herself to go by the wayside of individuals trying to push down the throats of Canadians an untested vaccine. You have a real medical practitioner here, and I want us to blow up her practice. I want us to seek her out. I want you to leave your doggone GP right where he's standing or where she's standing, and let's make this lady our go-to practitioner, because anything your doctor can do, she can do too. She's got the coverage for it. She's legally allowed to do it. And so we're going to blow up her business. I'm like, right now, if I have a problem coming, you take OHIP, right?
That's the challenge. Unfortunately, they don't allow nurse practitioners to bill OHIP, right? That's the challenge.
They don't let y'all take OHIP?
Wait
a minute. When I go to my doctor and he can't see me, they let me go to a nurse practitioner and she takes OHIP.
So
what do you mean you can't take OHIP?
So let me explain. So when I was working with the family health team, there's funding from the government. That's how our salary is paid. Mm-hmm. So we get a set salary as from the funding from the government. So nurse practitioners, when they work independent, they have to get paid by the Ministry of Health or by a physician, or you work independently and do private practice, because we cannot bill OHIP. Obviously, your blood work, your ultrasounds, your MRI that's ordered by us, obviously it's all covered, but your visit with us, our time is not covered. So it is private practice. That's the challenge.
So you need a doctor to pay you via the funding that they receive to really get your money, or you need to charge privately, like a doula,
yes,
or a
naturopath,
a midwife,
yes,
or a naturopath.
Well, midwives are covered by OHIP, yes. But a
wow, a midwife is covered by OHIP, but a nurse practitioner is not?
No. However, we do have So a lot of people's extended health benefits may cover nursing services, right? Some people's
Right.
extended benefits will cover nursing services. I've had people successful in billing and getting reimbursed from their extended health care when I provide
Right.
services to them. So
For
that's
Americans, OHIP is our Ontario Health Insurance Policy, is what Obama tried to do for y'all. Because I have many Americans who watch this. Most of my viewership is from the United States, and most of this will be viewed in the U.S. and hopefully Canada too. But tell me this: what can we do now to advocate for you? What can we do now to put pressure on the Ministry of Health? Who else are the tribunals? We have the Ministry of Health. Who else do we have? Because we want to form a petition. We want a nurse door petition. We want to rock the boat in Toronto
Thank
and
you.
Ontario for you.
Right. So the next steps in this whole process is my hearing. My hearing is scheduled in early January of 2024.
Okay.
I want people to be aware of this case, because to me, this case really, it makes me wonder, why have they been so heavy-handed with me when all I was doing was offering information to those who were interested? I didn't seek people out to take my course. It was those who were interested. A lot of people
Right.
that did their own research, that already knew they didn't want it. But unfortunately, in this climate, they had to have their choice validated for some reason. So I
Right.
wanted to offer an outlet for
Alternative.
them.
You
Right.
and you wanted to give somebody the other side of the coin, right? There's always two sides to a conversation, and the side of COVID-19 vaccines is potential issues and what it was in it. That conversation was being smothered, and you gave a voice to that other side from a medical perspective, not just a subjective opinion. You used what the actual manufacturer was saying was in, but hiding it, and you informed people, and they made their own decision. Period.
Thank you.
And
And in
so
fact, they
that's
had made their decision before they saw me. But they
right,
needed, unfortunately, a practitioner to validate it for some reason. So
right,
I wanted to give them an option because nobody else was listening to them, right?
right.
And I knew there was a risk. In fact, I sat my children down and I said, listen, guys, I'm going to embark on this. I need to have your support and your permission to do this because it may impact us. And they're like, Mom, if you feel strongly about it, you have to do it. Because
Right.
but I will earnestly say to you, I thought they would look into what I was doing, recognize that I was just simply informing people, and then maybe say, Miss Dorr, stop. We don't want you to do this anymore. And
Mhm.
then they're my regulatory body. I would have had to have stopped because I would know I don't want to lose my license.
And some people are going to say, well, that's the part you were a little naive. They were going to come for you, and they have come for you. They will continue to come for you. But now we're coming for them.
Thank
That's
you.
all. I'm gonna say it like that. They can come. They can't come for you no more because they can't. I'll say it like this: they can't come for you no more. Free nurse door.
Thank you. That's what's up.
But that's going to be the hashtag. It's free nurse door. I'm
You.
gonna put it on a T-shirt. We're
Yeah.
gonna create a campaign around it, and I'm gonna keep talking about it all the way up to January. We're gonna
Thank you.
keep spreading the word about it. We're
Thank
gonna
you.
bring you back on the show. I'm gonna make people put it on the socials before we leave because I know you have to go for 6:15.
Yeah.
What about scenarios where people have like cancer? Like, do you have advice? And I know it's kind of off. It's not the COVID, but like, what about individuals who are going down that route? The doctors are saying chemo and radiation, and is that something that you would speak to? Would you deal with the cancer patient? Would you have other methodologies of how to deal with cancer? Well, I have heard about so many different types of like the vaccine of the mumps vaccine, apparently a concentrated vaccine of the mumps. I've heard of frankincense, which is a very good, apparently, cancer treatment, liquid frankincense. Is that in your wheelhouse in respect to that a little bit?
So first off, anybody facing a cancer diagnosis, the first advice I would give is to recognize your mind is the most important tool in your healing. right?
Right.
That's the first thing that I would tackle. That's where I would have my expertise, right? And then there's always alternatives, always alternatives. It's very difficult on this platform to speak generally if we're not
Mm-hmm.
talking about specific cancer or whatnot and so forth. And I wouldn't want to give advice without a specific,
Of course, right?
right, right,
Right.
person to assess. But yeah, listen, you can't. I would give this advice to every patient.
Mm-hmm.
Not only cancer patients, any ailments, anything you got going on, you got to start up here, right? And that's something that I've learned over the last 3 years. I've really learned to question my medical education when I learned that John D. Rockefeller is the one that started taking over medical education in the 1770s. And then prior to that, the primary source of treatment was plant-based. But after Rockefeller took over medical education is when pharmaceutical-based treatments took over, right? So I really had to relook at health and medicine and everything that I've learned, but I'm in the process of learning and relearning and integrating. So that's what's up. I hope that
This
answers your
brother asked a question right here. Yes. Do you expect a surge of any variants? I think he's assuming of COVID coming, and like, have you heard anything like that? This is just some of the people asking general question.
I worry. I don't. I worry. I just really worry because I feel that I almost feel like we're being attacked. And I know if that's weird to say, but I feel like that there's so much pressure on humanity right now. I feel like we're being attacked from so many different areas, financially, mentally, environmentally. It's just, I don't want to speak in specifics, but I worry. I worry for
Right.
humanity. I would encourage everybody to boost their immune systems, is what I would say.
Okay. And, I know that there's a lot of comments that I was just trying to check all the comments and follow all the comments. I'd like you guys to share this video. I'd like you to get it all around this, all the spiel, Cyclopses, Adi Al-Katani, the Spice Man. Listen, Spice Man, tell us what you have to boost our immunity. But all of the individuals that support this channel, we need to share this video, share it to your socials, please. And let's continue the conversation about Free Nurse Door. Okay.
Thank you.
Let's continue that particular conversation. Free Nurse Door. And I'd like to thank you for coming on. I'd like to thank you for your courage, and as a woman of color standing up against a monster that you decided to take on. And I don't, like you said, you weren't 100% sure how they would come for you, but boy, they came. And now we got to make them regret it. Now we got to make them regret it. We got to make them look and say, you know what, we should have left that lady alone. And we're going to make sure that they can't go any further. How about this too? Can you get your nurse practitioner in the U.S.?
So I can, yeah. The whole reason
is
why
that a backup? My daughter is actually a travel nurse who works in Florida.
Yeah, I definitely can. I definitely have flexibility. That's the reason why, again, when I did my nurse practitioner, it wasn't a master's program, but I was still a nurse practitioner, but I just went back and got the master's so that I would have the flexibility to work in the US because they do require that. So I have it.
So we know you're extremely employable, right?
I am.
And
I got a lot of fear. I want to help. There's so much. I feel like I've been stifled for the last 2 years. I haven't been able to help people, and I realize I need to do it. It's part of
right.
why I'm here.
And that leads to, because we talked earlier. You're talking about your entrepreneurship and everything, and that leads to all of the businesses that can spew out of you. So you're just you're walking potential, but right now you're under fire, and so we want to take that stigma off. But we're going to talk again. We're going to we'll talk privately too, but we'll talk again about now what somebody with your professional designation can do in respect to starting all of her businesses coming off of all of the things that you're going through. So I want to see your book come out. I want to hear screenplay writers writing the movie about it. This is your living legend right here. Okay, nurse practitioner Melissa Sadore, free nurse door. To everybody on the spiel, we love you. God bless you. This, I really thank you for reaching out to me. We've spoken to each other multiple times, and I'm so glad this was the time that we decided to come on and to do this show. And I'm excited for what's happening for you in the future. All right. Any closing words?
No, I just want to say thank you for having me. Thank you so much for taking the time out and agreeing to share this story on your platform, because I really think it's important that we know what's happening, right? I feel like these cases happen in the shadows and people aren't aware. Right. So I'm grateful to you for agreeing to put this on your platform. So thank you.
My pleasure. I'm thankful. My platform's been begging for great. People know I hate bad content. And so I always tell them the reason you don't hear me as often is because I'm not here to talk. I want people to be informed. I want powerful content. I want life-changing things. I want to shake up the world. And otherwise, I'll just sit under my coconut tree and mind my business. So God bless you. Free Nurse Door.
That's right. Free Nurse Door. Thank you.
Bye.
One love, everyone.
One love, everybody. Good night. Okay.